The country is now seeing the highest number of new COVID-19 cases since the virus first reached American shores back in March. More than 300,000 Americans tested positive between Thursday and Saturday. With colder weather and flu season already underway, public health experts are warning it will be a tough winter. For more now, Dr. Bob Lahita joins us. He is a professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital. Thank you for joining us. So I wish it was under better terms. What's the top line here? What's it going to take to slow the spread?
Well, as you know, Lana, people have not been mitigating. They've not been wearing masks. They've not been keeping social distancing. The whole effort to combat this virus has been politicized to some degree. And as a result of that, you have people the numbers are increasing. And particularly in the Midwest and in the Western states, the numbers are off the wall. Now, we're not as bad as Europe, which is way ahead of us in both fatalities and hospitalizations. But in some areas of the country where there are rural hospitals and not enough ICU beds, things have become very problematic, much as we saw in the Northeast back in the early spring.
Well, how stressed are hospitals across the country at this point?
Very stressed. You know that in the Northeast, we have an abundance of MICU beds. And back in the spring, we were stressed. We had to open up 3 additional ICUs in our own institution. So you don't have that luxury in small towns and small cities in the West, where they may be servicing a radius of 100 miles. So consequently, they have to bring in extra people, extra intensivists, extra critical care nurses and advanced practice nurses. And it is very difficult because it's really trying on the system. It's very stressful for everybody. I can experience that. I did experience that myself back in the early spring, and I can only imagine what people are going through in the Midwest. Lana?
Yeah, we do remember how so many doctors, healthcare providers came to help us in New York when we were really struggling with it. Well, as you mentioned, Dr. Lahita, several European nations are really struggling right now with the coronavirus, and as a result, they're ramping up their restrictions. Is it just a matter of time? I hate to even ask this question, but a lot of people are wondering, might that happen here in the U.S.?
I think it may happen here. You know, we've heard all kinds of misinformation about whether we should wear masks, not wear masks, socially distance, wash our hands, etc. But it is very clear that as the weather gets colder and we are forced inside, and when we're forced inside, we're together with, less than 6 feet of social distancing, the rate of infections are going to go up. Now, the good news is in the Northeast, at least, we have seen infections in a rather stair-like fashion, very slow, not the immediate surge that we saw in the spring. And also I can happily say that we know a lot more about treating the disease, and people are being kept off of ventilators as much as possible. High-flow oxygen, BiPAP, CPAP is what is being used right now to control breathing, Lana. So we're going to see a definite uptick, and I hope it's not going to be the surge that Dr. Fauci has suggested.
Well, we're all hoping that we're all rooting against the virus on this one. You did also mention, though, that there has been misinformation that has caused COVID to continue to spread. There's also been a fair amount of hubris, I think. Can you put a number on how many American deaths might have been caused because of this spread of misinformation? Or said a different way, how many American deaths might have been prevented?
I suggest, Lana, that tens of thousands of deaths could have been prevented. When one gets out and says, oh, it's not important to wear masks, and you go to demonstrations, or you go to a football game or a soccer match at the local high school, or worse, what we saw during Halloween was Halloween parties where there were as many as 200 or 300 people in a closed space. And then the aftermath of that was 30 positively infected young people. That's the kind of thing that has got to stop. There's an end to this. There's an end. We see light at the end of the tunnel with the vaccines coming. But right now, before the holidays, we have to learn to mitigate. And that means wearing a mask, social distancing, and washing our hands. I always said, Lana, that we should behave as though this virus is radioactive, that anything we touch conceivably could have the virus on it. So you've really got to be careful and very mindful of what you do, where you are, who you're talking to, and what you touch. Lana?
Well, Vice President-elect Joe Biden is expected to announce his coronavirus task force on Monday. What kind of experts would you like to see in that group?
I'd like to see infectious disease experts, epidemiologists, virologists, and people who are used to handling pandemics or epidemics of sorts. I'd like to see the people that I know so well at the National Institutes of Health, the CDC, and the FDA. I think the vaccines are coming along and they're being looked at by the FDA advisory panels, and that's good news, and they should be approved by mid to late December so that we can roll it out to the public in April. That's the kind of thing I'd like to see. I'd like to see mitigation so that we cut the numbers down, so I don't wake up to hear that there were 100,000 new infections tomorrow, which is possible. And those numbers are only going to rise with the holidays when everybody likes to get together, family gatherings. We see people during the Christmas time having parties, et cetera, and they don't wear masks. They don't pay any attention to what's happening. That's got to stop. From a doctor's standpoint, that's a disaster. Lana?
It's going to be a hard holiday season, I think, for a lot of people. While we were talking, though, about President-elect Biden, you saw the outpouring of spontaneous celebrations that happened. In some places, people did seem to be keeping masks on, socially distant, but there were also large crowds of people who were all together. I'm wondering if you can comment on that, and it also, I think, foretells the possibility of an inauguration day with large crowds that would like to gather in Washington, D.C. As a healthcare professional, how would you like to see this inauguration roll out?
Okay, so that's a good question. First of all, the inauguration is January 20th. It's extremely cold during that time of the year. I would like to see everybody looking at their computers, their cell phones, their television sets, rather than gathering in the mall, as they did 4 years ago. I would like to see people on the dais being screened with temperatures, being taken, congressmen, Supreme Court judges, everybody, including the president-elect and his wife, and President Trump and his wife. Everybody should be screened. And I say that because, you can be reinfected. So the fact that President Trump and Melania have already had the virus don't mean that they can't be reinfected. We know that for a fact. So the dais should be kept, everybody on the dais should be with social distancing. They should all be wearing masks. And everybody on the mall should be social distancing. If you have the nerve to go out to the mall and take that chance with crowds that are cheering and yelling, I don't think we need that. I think we have enough media where you can watch the inauguration and feel like you're right there watching TV or being on your cell phone or your computer. My recommendation would be to think very carefully about what you're doing. I'd hate to see an uptick of infections after the inauguration in people who should know better. Lana? I'd
be happy to host everybody right here on CBSN. All right, Dr. Bob Lahita, thank you.
Awesome. Thank you.